30 people in Uganda die of TB every day. The country is one of the 30 World Health Organization designated countries with a high burden of TB.
We expect about 90,000 Ugandans to be suffering from TB disease every year. That comes to about 240 every day. Unfortunately, we can only get about 200 every day as a country into the care. Means some good number remains out there transmitting the disease to other Ugandans.
The disease is transmitted by breathing in air contaminated by TB bacteria, mostly in congested or highly populated places. And in Uganda, the disease is said to be more common among men than women. Health officials say men only show up for treatment when the infection is persistent.
It is estimated that if you have TB disease which is not treated, you will transmit it to about 10 to 15 people in a year. So your loved ones at home, your children, your wife, the people you work with are at risk of getting TB from you if you do not attend to the cough that you have.
But Uganda says it has put in place systems to identify, diagnose, and treat the disease at zero cost to the patient. This has been supplemented by a door-to-door campaign to trace contacts of TB cases. According to the UN World Health Organization, global efforts to combat TB have saved an estimated 66 million lives since the year 2000. But the COVID-19 pandemic has reversed years of progress made in the fight to end TB. According to the World Health Organization, global TB deaths increased in 2021 for the first time in a decade at the height of the pandemic.
Most people did not access the treatment services, and those who accessed late, and that contributes to death. The disruptions in services were high.
The situation has been aggravated by the emergency of multi-drug resistant TB, which remains a public health crisis. And TB specialists largely attribute drug resistance to incomplete courses of medication due to the long period of treatment.
There is also rampant mixing of people who have had poorly treated TB with the general population, and therefore exposing others to resistant strains. We also note that the generation of medicines, new medicine molecules, needs to be stepped up, such that we get more flexible regimens, shorter regimens, more tolerable molecules, in order to improve palatability of these medicines to the people.
The UN argues that while Africa is leading the strategy to end TB, funding for TB prevention, diagnosis, and treatment services continue to fall short. And the UN wants countries like Uganda to invest more resources to fast-track the fight against TB to achieve commitments made by global leaders to end the TB epidemic by 2030. Michael Baleke, CGTN, Kampala, Uganda.